Hi, I'm Dr. Teresa Lyons, creator of Navigating Autism and Eat to Heal Autism. And this week's Ask Dr. Lyons question is Palmitoylethanolamide, PEA, effective for those with autism? So first, a warning, PEA is not for beginners. PEA has been widely studied for various therapeutic areas in thousands of adults, but it is not well studied in children. PEA is not a supplement to start with, but for those who have a knowledgeable healthcare team in place, PEA can be an option. So please make sure that a special diet has been implemented for several months just to see if PEA is even really needed. Many times, the supplements that you think your child will need, they don't need once a special diet has been implemented for several months. Indications of need. PEA is used when someone has chronic problems with inflammation, depression, seizures, pain, glutamate imbalance, hyperactivity, speech delays, and behavioral problems. Serious adverse effects or drug interactions have not been found thus far in the literature with PEA. So what is PEA, besides a really long name to say, which is why I'm saying PEA? PEA is a saturated N-acylethanolamide in the endocannabinoid family. Now you might be saying, what is an endocannabinoid? And they are molecules that bind to cannabinoid receptors, and that's involved in neuromodulatory activities in the body. You might be a parent listening to this, thinking about cannabis as an option for your child. PEA is a molecule that works in a very similar fashion to cannabis. PEA and autism. This is probably why you're listening to this video, so let's get straight to it. In 2013, experiments in a mouse model with autism showed that PEA could influence sociability of the mice. In 2017, PEA was shown to influence social and non-social behaviors in a mouse model with autism. So you can see all these animal model experiments, they're very recent. So PEA is really a cutting-edge supplement. That's why it's not for beginners. Several case studies of those with autism, that's humans, showed that PEA or PEA with other supplements influenced overall autism severity, meaning it decreased overall autism severity. It also has been shown to improve language and also improve behavior problems. Now, these are case studies, so that means they've seen these changes in 1 or 2 children with autism. So the natural progression in research is to then do a clinical trial. So this year in 2018, a randomized parallel group, double-blind placebo-controlled study with 70 children with autism found that PEA added to risperidone had superior efficacy in decreasing irritability and hyperactivity non-compliance symptoms. And they measured this using the ABC-C when compared with risperidone alone. So that is important if your child is on risperidone or if your child has any of the behaviors that are associated with being prescribed risperidone. So this is definitely something to talk to your doctor about if your child is on risperidone. And now towards the end of this study, it was 10 weeks, there were signs that PEA was actually decreasing inappropriate speech, but the study, it really wasn't long enough to see more. 10 weeks it's quite short of a period to study, such changes in a child. So there were signs that PEA was decreasing inappropriate speech. It just wasn't a long enough time period to see more of a change. But within those 10 weeks, they did see quite a difference for irritability and hyperactivity non-compliant symptoms. So PEA alone. Many of you might be thinking, well, what if I just gave my child PEA alone? What have the studies shown? Well, they're doing them now. So scientists are now studying if PEA could be a standalone therapy for autism. And they base this on the conclusions from the clinical trial this year, showing that in 70 children with autism, there was a better efficacy when adding PEA to risperidone. So now it's very logical to study PEA as a standalone therapy for autism. And there weren't any major adverse effects when PEA was added to risperidone. And that's beneficial information to have as a parent. And here are some references.